So with the greetings of the day, we'll start with the next part of the discussion, specifically on the frequently asked questions on Rasoushadies in routine practice, wherein we'll be discussing many points, the queries, where we have certain doubts in our routine clinical practice, especially whenever we are dealing with metals and minerals as therapeutics. Then the way how it should be administered, the way where it is being prescribed, what are the clinical conditions, we'll be having various doubts. So based on that, we shall try to discuss few of the queries of those kinds and try to enumerate what best we can do. So in the previous session, we have discussed about the general concepts about how the Rasoushadies are being prescribed, how it should be considered in a clinical perspective, and what are the possible events which can happen by selecting or administering the Rasoushadies. So today we'll be discussing about a couple of conditions, the clinical conditions where the Rasoushadies are being prescribed. Of course, there are lots of clinical conditions wherein the Rasoushadies can be prescribed. The whole index of the textbook of Kaya Chikitsa could be treated with the Rasoushadies. And most of the disorders are being very well managed with that of the Rasoushadies. And once when I speak about the management with that of the Rasoushadies, it could be a palliative management and a very extensive way of a conservative type of managements, wherein we'll be going across with so many of the Rasoushadies, wherein it can be given with the therapeutic properties of the metals and minerals in such a way like it is much ensured safe in a prescribed dose and expected to have a desired result. There are lots of clinical challenges where we need to face. There are lots of clinical conditions wherein we need a mild, moderate or extensive treatment modalities. Among that, one such a clinical condition which is very commonly observed and people are ready to invest or dream about, or the condition which makes a person psychologically as well as physically gets debilitated, is the infertility. So can the Rasoushadies be prescribed in infertility is the next frequently asked question. So can they be giving attribute, can they be giving their benefits to any of the individuals by prescribing the Rasoushadies, metals and minerals in infertility is a query. So based on that, I would like to get back to the stories, the mythological perspectives which is given from the textbooks. Most of the drugs which is being explained in the textbook are related in mythological way to that of the virya of either of the gods. Say for example, Parada is considered as a Shiva virya, Gandhaka is considered as a Parvati Raja, Abraka is considered as a Parvati Bija or Parvati Raja Bija. So similarly you have Tamra as Kartikeya virya, Naga as Vasuki virya, Vanga as Indra virya. So we have various relationship with either of the gods and their virya with specifically related to that particular dhatu or a mineral. So I would like to say they would have been compared it to any of the substances. Why did they compare specifically to that of the virya? When we come into the general terminologies, when we refer into the textbooks of Ayurveda, might be it is the Samhitas or either of the textbooks, wherein we come to know the virya of an individual, it's nothing but a acceptance or a condition wherein the person will have the essence of the body. All dhatus of the body, wherever you have so many dhatus of the body, they are being converted into the essence of an individual and it is called as the virya or the shukra dhatu. So the essence of an individual, it is something like sattva. Just like you extract the sattva from the minerals, so similarly the same way how the essence of an individual is in the form of the shukra dhatu, and this particular shukra dhatu is much essential and it's the sara of the body and it is the chief essence of the body. And there are many clinical conditions wherein you have enumerated from the textbooks as Pratilomakshaya and Anulomakshaya. So wherein you have any of the dhatus, the precursor dhatu, the Rasa, Rakta, Mamsa, Meda, Asti, Majja, any of these dhatus gets severely depleted. It shows its impact on the next dhatu as well. So similarly in this kind, if a person is suffering from any of the disorder for a chronic time wherein his Rasa, Rakta, Adi dhatus are depleted, the ultimate thing is even the Shukra gets depleted. And once all these dhatus are depleted, they are reduced, they are being deteriorated in the body, then it's going to affect the Ojas as well, because the Saratha of the body is being affected. So Dhatu Saratha is affected, the Ojas is also affected. Once Ojas is affected, the person starts to have a downfall. The person will start to have deterioration in his health. Then ultimately the person will end up into death as well in case if it's not been treated in time. So this is the importance of Rasoushadies, Dhatus, Ojas. And based on this grounds, there is another concept in the Ayurvedic concepts wherein we go with the Anulomakshaya and Pratilomakshaya. So the other way is in the reverse direction. It is from the Shukra you have a debilitation, you have the Kshaya in an individual, and because of the severe debility in the Shukra, the previous Dhatu also gets depleted. And if it is not treated, even the previous dhatu also will get depleted. So it goes. So many times you find them either in the conditions like syndrome-like presentations like Raja Ikshma, or any such conditions where you have the Pratilomakshaya or Anulomakshaya. So in either of these conditions wherein you need the drugs to act in such a quick way that it can show its impact on a particular dhatu or on a particular level of the shrotases in an individual, and the chief's choice could be the metals and minerals, the Rasoushadies. We have another concept, Vriddhi Samane Sarvesham Viparite Viparyaha. So you have a concept stating like similarity is what you consume. The essence of the body or the similar dhatus of the body will get enhanced, will get increased. So on that grounds it happens like the person Rasam Rasena Vardate, Raktam Raktena Vardate. You have this saying many times where you find related to that dhatu, the person starts to consume any of the medicine or any of the drugs or food, then that particular dhatu is going to get increased. So similar to that particular concept, it happens like the person will have a sort of the various of so many gods in the form of metals and minerals in Rasashastra, Viryam Viryena Vardati. So whenever we are speaking about the infertility concept, the dhatus which are being explained mythologically important as Viryas or the Shukra or the Shonita of a particular gods of the Indian mythology is being related to a Shukra dhatu. Those drugs are being given to the individual. By administering to the individual, it happens like the person will have an increase in the Shukra dhatu because Shukram Shukrena Vardati. I give Parada to a person, the mercury will increase the semen of an individual because it's a semen of Lord Shiva. Shukram Shukrena Vardati. So on that grounds, with this particular concept, I try to say that in case if you have any of the cases with that of the Shukra Kshaya like personalities, wherein you could identify the Kshaya Rupa of either of the dhatus in an individual, you are supposed to prescribe them with either of these metals or minerals into therapeutic forms, so that he has a concept of Ayurveda as a Vriddhi Samane Sarvesham. And based on this grounds, you are supposed to enhance it. The way you process these particular Rasoushadis also should be in such a way like Samskaram Gunantaradhanam. So might be it is given with Anupanam, with that of any drug which is acting on the Shukra Dhatu. Might be it is with Ashwagandha, with Shatavari or anything of those kinds. And also you need to assess the patient condition for what complaint he has come with, and based on that you are supposed to treat him. So this is about the Rasoushadis which can be given, especially in infertility. When we speak about the infertility, it's a very, very large topic. So we will not be discussing the whole concepts of infertility here. We will be discussing in general, in short, about what it can be prescribed, what medicines can be prescribed in infertility, because it's a session with the frequently asked questions where whether Rasoushadis can be prescribed in infertility. So few of the drugs which can be prescribed based on those grounds are something like Makaradwaja, extensively used drug. It is equivalent to something like a fertilizer which you add up to a plant and it grows in a healthy way. So similarly is the Makaradwaja for an individual. It is also very much essential and with a small alteration it is called as a Purna Chandrodaya Rasa in some textbooks. So with the small alterations, the Purna Chandrodaya Rasa is something like Chandra is being affected with the variations in his health aspects, and he is being compared in the chapter of Raja. So on that grounds wherein to do the Paripurnata in the Chandra, to just like a person is being depleted because of his dhatus, like Shukra Adi dhatus in the body, by administering the drugs like Purna Chandrodaya Rasa, the other dhatus are also going to build up in an individual, and by that it happens like the person will have a total completement. A person will have a total completement in his body configurations, and on that grounds this is the significance of advising Purna Chandrodaya Rasa or Makaradwaja. Both are almost the same. So which can be prescribed in any of the individuals wherever you expect any of the dhatu nourishment is being hampered. Wherever you need the paripurnata in the dhatu, then you need to give the Makaradwaja in those people. Similarly are the choices like either Abraka or you have even the Gandhaka. So in my previous sessions when I was discussing about these topics on Abraka and Gandhaka, I have even enumerated about the concept wherein the Acharya from the textbooks has explained, especially the Rasavagbhata from Rasaratna Samuchaya has explained about the concept as Devya Rajo Bhavet Gandhaha. So the Rajas of the Devi has converted to the Gandhaka, whereas the Shukra or the Bija portion has been converted to that of Abraka. So whenever you have a person with the Bija dosha, whenever a female is having a Raja dosha, wherever she is having some complaints with the menstrual cycle or any alterations in her menstrual health, then you are supposed to prescribe her with the Gandhaka compounds, because Devya Rajo Bhavet Gandhaha. So with Gandhaka compounds or Gandhaka related drugs you are supposed to treat the humans wherever you have the problems related to the menstrual cycle. In case if you have a problem with that of the Bija in a female specifically, then you are supposed to prescribe it with Abraka. Especially whenever you have the size of the ovum is very small, it is shrunken, it's not forming well, where you got the atrophy, where you got the conditions where there is a depletion in the ovaries or in the endometrium or any of such pathologies clinically enumerated, then in those conditions my choice of drugs could be Abraka. This is for sure. You have endometrial atrophy, you have certain conditions where thinning of the endometrial wall is being observed in the female. Wherever you have the shrinking of the ovaries, wherever you find the size of the ovum is very small, it is not well built, then we need to prescribe them with that of Abraka. I do remember here a case where she had a very small ovum. Husband had oligozoospermia. The counts were severely less, and they have opted, because her life, their age was somewhere around 40. And they did not have time, and I'll say late primary is associated with many complications. So late primary is really not recommended, and they don't have chance, they don't have the time for having a trial base like whether they can conceive with administering of the Ayurveda medicines or anything like that, because they have tried for nearly 10 years with the other system of medicines whether they can really have some benefits of taking with either of the drugs. But they could not succeed. So somehow with some medication the sperm count of the male partner was being moderately built up. I don't say it was extensively normal, but we had a moderate built up. But unfortunate thing is, to go for a IVF, she had a very small ovum. So for that particular person of such conditions, clinical conditions, considering this concept of Devya Rajo Bhavet Gandhaha and the Shukra as Abraka. So Abraka was being given to the patient wherein the ovum has turned to a very normal range. and even it was a very appeasing thing for the doctors for conducting a IVF, wherein they praised for the size of the ovum, which is being framed to such an extensive way as a classical size of the ovum. Because then they have thought something like she might never conceive even with the support of IVF. Many times you have such conditions when you sit in your clinics. So whenever you have such conditions in the female, where you have the depletion, where you get the atrophies, you have some conditions where there is a debility in either of the female reproductive organs, in those conditions, my choice of drugs could be abraca. In case there is a menstrual abnormality, you have metrorrhagia, menorrhagia, amenorrhea, any of such conditions, then my choice of drug could be gandhaka. So, especially whenever you have the clinical conditions like arthavakshaya, in those conditions, I recommend to administer gandhaka. Then in case if you have any problems with the shrinkering of either of the reproductive organs, including the bija, or especially that of the female, then the choice of drug could be abraca. So similarly, whenever we want to see that something like the pushpa or the ovum needed to be bloomed well so that she is ready for fertilization, whenever you expect like the couples want to plan up for consummate, then the choice of drugs for those people, or for the set of people wherever they are unable to conceive because of some reason, like the ovum or egg is not properly released into the system so that it has a normal fertilization. So in those conditions, my choices are most of the times it is with the pushpa dhanva rasa. So wherein the pushpa will attain a normalcy and it is ready for the fertilization. Very promising drug is again Chandra Prabhavati, which can be used in so many conditions because it is Dipana, Pachana, Anulomana, Rasayana, and also it is very much advised in most of the hormonal abnormalities. Nowadays I'll say many of the clinical conditions are with the hormone abnormalities. You have a patient with PCOD, you have a patient with fibroid, you have many such clinical conditions wherever you have some abnormalities because of the hormonal imbalance, especially in the female, where they have altered menstrual cycle, wherever they have excess or less flow, where in the female wherever they have the erectile dysfunctions, in the male especially when they have premature ejaculations, or any such clinical conditions wherever you find a sort of a debility or a sort of a condition wherever it is been related to the hormonal imbalance. In those conditions, the choice of drug could be Chandraprabha. Similarly, you have the other drugs like Vajra, which is again Uttama Rasayana Dravya, and it is Shrestha Rasayana. Swarna, no doubt, lots of praises is already been done on the Swarna, and it is a promising drug in many of the infertility conditions as well. It is considered as Agnivirya. So whenever you have the genesis of the Shukra in the male or the female is being affected, in the formation is being affected, then you need to administer him some Agni Tattva, because Agni is again, I do consider here as a Dhatu Agni, wherein it need to be formed in a proper way, and that particular Agni should stimulate the Dhatu in such a way that it can have its normal nourishment. It can have its normal nourishment, remove the blocks if at all they are present, and make the genesis of that particular Dhatu in a normal way. And one such a drug is the Swarna. So Swarna is a it's a Agnivirya, wherein it is very much essence component of the Agni Tattva in a very beautiful way, and it can enhance the properties of the Shukra Dhatu. So Swarna is again very ideal there. Vyadhi Harandras, wherever you have the conditions like the torch panel is being positive, they are infertile because of the reason they are being affected with some infections, viral infections or childhood infections, which has been reflected in the active conception period. So in these conditions, wherever you have, we administer them with that of Vyadhi Harandras. So, but Vyadhiharantas, while administering, be cautious because Rasakarpur is an ingredient. You should encapsulate and give it, or roll it in between the Guda, and it is being prescribed to the patient. It is almost a promising drug in many infective pathologies. Because of the infection, a person is being landed up into such complications clinically. So, in those conditions, Vyadhiharantas should be prescribed. So, if I start to enumerate, I'll be having another 100 of such drugs at various conditions where we can prescribe. So with this gist, like various types of infertilities generally enumerated in a clinical practice, I try to enumerate a couple of them. So it could be addressed in the clinical conditions. It could be, many of these components can be given in oligospermia, erectile dysfunction, premature ejaculation, reduced sperm count, any of such conditions. And similar things are also being observed even in the female components. Whenever you want to speak about the Vrishya set of drugs, Vrishya is about the general well-being of the Shukra Dhatu in both the people, either it's a male or a female, wherein you need to give a sort of a normal nourishment or upgrading of the Dhatu, or achieving the Dhatu Sarata in an individual, especially the Shukra Sarata in an individual. Then you are supposed to prescribe them with that of the Vrishya set of drugs. You have the list of drugs, the list of references from the textbook, chapter number and shloka number. So you have the drugs which can be prescribed as a Vrishya category, wherein you have the drugs like Abraka, Vaikranta, Makshika, Vimala, Shilajatu, Chapala, Varatika, Hingula, Swarna, Rajata, Kantaloha, Mandura. So you have many such drugs which can be given. Like you have even like Vanga, Manikya, Mukta Shukti, Panna, Vajra, Neelam, Vaidurya, Rajavarta, Gunja. So you have the varieties of choices. Many of the drugs here which can be prescribed. Virya Stambhaka, many times it happens like might be it is premature ejaculation, either in the male partner or in the female partner. Because of ejaculation of the ovum, the fertility rate comes down prematurely. So in those conditions where you need the drugs like a Virya Stambhaka, you need to prescribe them with that of Abraka and Bhang. So Bhang is not available because it's illegal into practice. At least we have the Abraka Vasma, which is very conveniently available to us, and Abraka can be prescribed as per Rasa Prakasha Sudhakara 5th chapter, 28 shloka. Whereas Bhang is also been advised as per Rasa Tarangini, 24th chapter, 400 shloka. So whatever is being available, in case if you want the Stambhana action in an individual, then you are going to prescribe these things. So in case if you have Virya Vardhaka, where you have oligospermia, oligoazospermia, any of the conditions where you have the Kshaya, even in the female you have the Kshaya in an individual, especially with that of the Virya, then you are supposed to prescribe them with the drugs like Swarna, Haratala, Kantaloha, Jasada, Mauptika Shukti, Pravala, Shankha. So either of these drugs can be prescribed to them, wherein you have a sort of a Virya Vardhana property in an individual. Similarly, in case if you want any person to have the Stanya Samvardhana, so in case I do usually recommend this particular thing for anyone in the postnatal period. I do prescribe them immediately after the delivery whenever there is active lactation. Some people complain like the lactation is insufficient. So for all those people I am prescribing them with that of Abraka Vasma. Abraka, as per Rasa Tarangini 10th chapter 72 shloka, Stanya Samvardhana. Similarly, Stri Pushpa Janana. There are some conditions like amenorrhea wherein the ovulation is being affected in an individual. There is anovulatory cycles. There are conditions wherein the problems are because of the ovulation in an individual. So in all those conditions, whenever I do prescribe them with that of Tankana. So by administering Tankana, it happens like the Pushpa Janana happens. There is a ovulation either in the male or in the female. Both the conditions you find, but specifically the reference is to the females, Stri Pushpa Janana. So it is very specific to the female, but I have observed this particular phenomenon even in the males as well. but it is in respect to the depleted sperms. So in either of the conditions, wherever it is, but anyway, the reference from Rasatharangini 13th chapter is Stri Pushpa Janana, that is Tankana. Similarly, in case if we are very specific to have the Shukra from both the partners again, don't consider Shukra is only for the male. So Shukra for both the partners, Shukra Vardhana, it is you have the drug of choices, something like Abraka, Shilajatu, Gandhaka, Vanga and Gunja. So these are few of the drugs as per the classical textbooks here, wherein it can be given for the Shukra Vardhana, wherein you have Shukra Vardhana in an individual. Napunsaka Nashanam, in case if you have because of any reasons, you don't know, there is a condition clinically in infertility called as infertility because of unknown origin. You find all conditions are normal, all investigations are normal, but still the couple will not conceive. So in those conditions wherein you are unable to name, you are unable to tag what is a clinical condition, then blindly I'll say Abrakabasma will help them a lot. Napunsaka Nashanam, Abrakabasma is one of the best drug which can be prescribed in those conditions. So this is one of the prime component which can be given in most of the infertility cases. Narasya Pushtikaram Vanga. So in case specifically to strengthen the male or the male factor, then you are supposed to give the Vanga Basma to an individual as claimed by the textbook of Ayurveda Prakasha, 3rd chapter. In case if you have the clinical conditions like that of the Dvajabanga, so you need to prescribe them with that of the Manikya or Bhang in case if it's available, because it's illegal nowadays, so it's not available that easily. So Manikya is available. So Manikya can be prescribed to those patients as claimed by Rasatharangini 23rd chapter. And in case if you have the Garbhasrava, you have the patients suffering from Garbhasrava. So in those conditions, the choice of drugs could be Ahifena and Bhang. But unfortunate thing is both the drugs are not available. Ahifena is not available to us and Bhang is also not available to us. So in case if somebody can procure, or in case if there are legal techniques of procuring them and administering them only for the therapeutic aspect, then it is something like a Garbhasrava. For Garbhasrava, the prescriptions could be Ahifena and Bhang in such clinical conditions if you have in your practice. So Garbhashaya Chutihara, Vanga is the drug of choice. Garbhashaya Vishodhana Rajata. So whenever you want to do the Shodhana, so this is the reason why in a pre-conception period I do administer Rajata Basma to the female partner for 3 months. Just to see, I want to ensure the Garbhashaya Shodhana has been occurred. Then I ask the couple to plan up for the consummate after 3 months. So initially I ask them to take with the Rajata Basma. So by taking Rajata Basma, Garbhashaya Shodhana occurs there. Similarly, you have Klaibhyahara. A person is being entitled as a Klaibhya. A person is being entitled as infertile or impotent or either of the reasons. In many of the conditions, Vajra proves to be very effective. So Vajra could be the drug of choice as claimed by Rasatharangini. As a sort of an aphrodisiac where the loss of libido or any of the conditions is being observed in the partners, then Kamini Madadarpanam, where you need to enhance the aphrodisiac property. Then Vanga, Abraka, Gauri Pashana, Naga, Kantaloha, Gunja, Bhang, Vishatinduka and Dugdha Pashana are few of the choices of drugs wherein it can be prescribed for Kamini Madadarpanam. Shukra is also essential for the Ayu of an individual, because in case the clinical pathologies because of the infertility is not alone only a dream of the couple to extend their generation. It could be a nightmare for their existence as well, in case if there is a severe depletion in the dhatu which can lead to the pratilomakshaya or the anulomakshaya, which is leading to the death of an individual or make the person to become more and more critically ill because of the clinical conditions. So for those people who are been in a ward off zone, in a alert zone where they need to be repeatedly getting infected, where the immunity is being falling down successively, wherein the dhatus are being depleted, in those conditions we have to give them with the Ayushya set of drugs. where you need to increase the ayu of an individual. Therein we are prescribing them with that of Abraka, Vaikranta, Swarna, Rajata, Tamra, Kantaloka, Naga, Manikya, Mukta Shukti, Pushyaraga, Vajra, Vaidurya, or few of the prescriptions. So in case if in general you would like to go for certain prescriptions which are in generally prescribed in infertility cases, or something like Purna Chandrodaya Rasa, Tridhatu Garbha Potali, Hema Garbha Potali, Rasa Garbha Potali, Shilajatu, either of these drugs, or with the conditions, of course, you need to assess the clinical condition, the individuals, and then you are supposed to prescribe them with either of the compositions. So many times I have found excellent response with the administration of the Hema Garbha Potali as well, with the Rasa Garbha Potali as well, with Ridhatu Garbha as well. So there are many clinical conditions, especially related with that of infertility, which can be addressed really well by administering any of these prescriptions, thus making the dream of an individual couple or family members to see that their generation is being extended. So these are the benefits of how the Rasoushadies can attribute their qualities in extensive way such conditions. So thank you very much. So with this we will try to have more interactions later on in the further sessions.